Here's something almost no appointment has time to explain. Every night while you sleep, your kidneys are doing some of their most important work. They're filtering your blood, regulating your blood pressure, and clearing metabolic waste that built up during the day. And what you eat in the hour or two before bed has a direct influence on how well that overnight process goes. Most kidney conversations focus entirely on what to remove. Less sodium, less potassium, less phosphorus, all of that matters. But there's an equally important and rarely discussed piece: what you can actively add to support your kidneys while they work overnight. Tonight, I'm walking you through 8 fruits, all verified as kidney-friendly by the National Kidney Foundation, that deliver real antioxidant, anti-inflammatory, and kidney-supportive benefits, specifically suited to nighttime consumption. Before we start, subscribe and hit the bell so you don't miss videos like this. And drop a comment. Where are you watching from and what time is it? I read every single one. Stay with me through fruit number 8, because it comes with a catch almost no other video mentions, and it's information you genuinely need before you eat it. How your kidneys actually work. I'm Dr. William. I've spent more than 15 years in internal medicine, and I want to take 2 minutes to explain something that will make everything else in this video make more sense. Your kidneys are 2 fist-sized organs sitting below your rib cage on either side of your spine. Together, they filter roughly 200 liters of blood every single day, about 50 gallons, removing waste, excess fluid, toxins, and metabolic byproducts, and returning clean, balanced blood to your circulation. According to the National Kidney Foundation, potassium is an essential nutrient that helps the body function properly, helping nerves, muscles, and the heart work correctly. However, people with kidney disease can experience dangerous levels of potassium called hyperkalemia if they consume too much, because damaged kidneys may not be able to remove the excess. This is the fundamental tension in kidney-healthy eating. Your kidneys need antioxidants and anti-inflammatory compounds from food to reduce the chronic inflammation that drives disease progression. But many of the richest sources of those compounds, bananas, oranges, kiwi, avocado, are also high potassium foods that challenge a weakened kidney's ability to filter. The 8 fruits I'm covering today represent the solution to that tension. They deliver real kidney-supportive nutrition, antioxidants, vitamins, fiber, and anti-inflammatory compounds without the potassium burden that makes other fruits risky in kidney disease. Let's get into all 8. Bedtime fruit number 1, tart cherries. The first fruit is the most uniquely suited to nighttime consumption of anything on this list, and the research behind it comes from some of the most credible sources in U.S. kidney medicine. According to the National Kidney Foundation, tart cherries contain phytomelatonin, a plant-based antioxidant that may contribute to a healthy circadian cycle. Sour tart cherries are specifically classified as a low-potassium food with less than 200 milligrams per 3.5 ounces and contain only trace amounts of sodium and are low in phosphorus. Cherries can be included in a diet for all stages of kidney disease. Here's why this matters so specifically at night. Your kidneys regulate blood pressure partly through a rhythm tied to your sleep cycle. Blood pressure is supposed to drop during sleep, a pattern called nocturnal dipping. When sleep is disrupted, that drop doesn't happen properly, and the kidneys absorb hours of sustained, higher pressure that slowly causes damage over time. Research published in PMC confirms that melatonin, serotonin, tryptophan, and phytochemicals in tart cherries may improve sleep quality by reducing inflammation and oxidative stress, with evidence that these compounds help regulate both non-REM and REM sleep stages. A pilot study in PMC, specifically studying older adults with insomnia, found that tart cherry juice produced significant reductions in insomnia severity compared to placebo, with effect sizes comparable to or exceeding those of valerian and some melatonin studies, two of the most widely used natural sleep interventions. Better sleep means better nocturnal blood pressure control, which means less overnight pressure stress on kidney filtering vessels. That chain of benefit is real and documented. What to do? 1/2 to 1 cup of tart cherries or 4 to 8 ounces of unsweetened tart cherry juice 30 to 60 minutes before bed. Choose sour or Montmorency varieties specifically. Sweet cherries are classified as high potassium and are a different consideration entirely. Bedtime fruit number 2, blueberries. The second fruit is one of the most well-researched superfoods in all of modern nutrition, and it happens to be ideal for kidneys specifically. According to the National Kidney Foundation, blueberries are a good source of fiber, vitamin C, vitamin K, and antioxidants. A 1/2 cup serving has less than 150 milligrams of potassium, making them a low potassium choice. They are also low in sodium and phosphorus, making them suitable for a kidney-friendly diet. They are safe to eat for all stages of kidney disease and all dialysis types. The specific compounds that make blueberries valuable for kidneys are their anthocyanins, the same anti-inflammatory polyphenols we discussed in tart cherries, but in different proportions and with slightly different mechanisms. Research published in PMC has found that consumption of 3 servings per week of blueberries or strawberries has been associated with meaningful reductions in cardiovascular disease risk through anthocyanin mechanisms relevant to kidney health, because cardiovascular disease and kidney disease share the same inflammatory pathway and frequently progress together. For adults over 60, this overlapping benefit matters enormously. Protecting kidney health and protecting heart health from the same dietary addition without adding potassium burden is exactly the kind of efficiency a kidney-friendly diet is looking for. What to do? A 1/2 cup of blueberries is a perfect bedtime portion, enough to deliver real anthocyanin benefit without adding a significant potassium load. Fresh, frozen, and freeze-dried all preserve their antioxidant content well. Bedtime fruit number 3, strawberries. The third fruit is one of the sweetest natural options on this entire list and one of the most kidney compatible. According to the National Kidney Foundation, strawberries are a good source of vitamin C, manganese, folate, and antioxidants. They're very low in calories, just 28 calories per 1/2 cup. Strawberries are a low potassium food containing only 130 milligrams per 1/2 cup. They are also low in sodium and phosphorus, making them a good choice for all stages of chronic kidney disease, including hemodialysis and peritoneal dialysis. 130 milligrams of potassium per 1/2 cup is one of the lowest figures of any fruit, making strawberries one of the safest choices even for people with more advanced kidney disease who are on strict potassium limits. A clinical study published in PMC found that dietary strawberry supplementation produced significant increases in plasma antioxidant capacity and glutathione levels compared to control groups, markers of reduced oxidative stress that directly relate to kidney health, since oxidative stress is one of the primary drivers of chronic kidney disease progression at night. Specifically, strawberries also deliver natural melatonin precursors and tryptophan, not at the concentrated level of tart cherries, but enough to contribute to a relaxed, sleep-supportive effect as part of a light evening snack. What to do? 1/2 cup of fresh or frozen strawberries, kept whole and rinsed just before eating to maximize freshness. For an even more satisfying bedtime option, pair them with a small amount of unsweetened plain yogurt for a complete kidney-friendly evening snack. Bedtime fruit number 4, apples. The fourth fruit on this list is the most universally available kidney-friendly fruit there is, and also the most underestimated. According to the National Kidney Foundation, apples are rich in antioxidants and fiber, and are low in potassium, phosphorus, and sodium, making them an excellent kidney-friendly diet choice. Eating the peel gives you 2 to 6 times the antioxidant power of eating the flesh alone. Apples are a good source of vitamin C and may help control blood sugar when chosen over fruit juices. They are safe to eat for all kidney conditions and treatments. For adults over 60, managing both kidney disease and blood sugar, an extremely common combination. The blood sugar stabilizing effect of a whole apple at bedtime has genuine practical value. The fiber in the apple slows glucose absorption, reducing the overnight blood sugar fluctuation that can complicate kidney function. There's also a specific kidney stone connection worth knowing about. The NIDDK notes that adequate hydration and dietary management, including citrate-containing foods, help prevent the most common type of kidney stone, calcium oxalate. Apples contain malic acid, a compound related to citrate metabolism, contributing to an alkaline urine environment that is generally more protective against stone formation than acidic urine. What to do? 1 medium apple with the peel on, eaten slowly as part of your evening routine. The peel is where most of the antioxidant and fiber benefit lives, so peeling it removes the majority of what makes it valuable. Pair it with cinnamon if you enjoy it. Ceylon cinnamon specifically adds blood sugar stabilization benefits that stack well with the apple's own fiber effect. Bedtime fruit number 5, grapes. The 5th fruit is one that many people with kidney disease are surprised to learn is considered kidney-friendly. The National Kidney Foundation specifically classifies grapes as a low-potassium fruit choice in their potassium guide, grouping them alongside apples, blueberries, cranberries, pears, pineapple, raspberries, and strawberries as lower potassium options compared to high potassium fruits like bananas, melons, oranges, and kiwi. The compound that makes grapes particularly notable is resveratrol, a polyphenol concentrated in the skin of red and purple grapes alongside flavonoids that give grapes their deep coloring. The National Kidney Foundation highlights that the red pigmentation in grapes comes from flavonoids, which may help reduce the risk of blood clots, a relevant benefit for kidney patients who are at higher cardiovascular risk. Grapes can even be frozen and eaten as a thirst-quenching measure for patients on fluid restriction. That last point is specifically practical. Many kidney disease patients are on fluid restrictions, and finding a satisfying, cool, hydrating snack option that doesn't add a significant fluid burden can be genuinely difficult. Frozen grapes solve that problem elegantly. They take longer to eat, feel cooling and hydrating, and deliver real antioxidant benefits while not adding the fluid volume that a glass of water or juice would. What to do? A small handful of red or purple grapes, roughly half a cup, as a bedtime snack. If you're on a fluid restriction, freeze them first and eat them slowly. Red and purple varieties consistently deliver more resveratrol and anthocyanin benefits than green grapes. Bedtime fruit number 6, raspberries. The 6th fruit might be the highest fiber option on this entire list for its size, and fiber turns out to matter more for kidney health than most people realize. Raspberries are specifically listed by the National Kidney Foundation as a low-potassium fruit choice in their potassium dietary guide for CKD patients, alongside blueberries, strawberries, and grapes. Half a cup of raspberries contains roughly 4 grams of fiber, double what you'd get from most other fruits in the same serving size. That fiber content matters for kidney health through 2 distinct pathways. First, fiber feeds beneficial gut bacteria, which in turn produce short-chain fatty acids that reduce systemic inflammation, the same chronic inflammation that drives kidney disease progression. A healthier gut microbiome is increasingly recognized in kidney research as being directly connected to slower CKD progression. Second, fiber slows the absorption of all nutrients consumed alongside it, including phosphorus from other foods in your evening meal. Since phosphorus management is one of the core challenges in a kidney disease diet, a fiber-rich fruit eaten alongside or shortly after dinner creates a mild but meaningful protective effect on post-meal phosphorus absorption. What to do? Half a cup of fresh or frozen raspberries as a bedtime snack. Frozen raspberries are often more affordable and just as nutritionally complete as fresh. Mix them with a small portion of tart cherries for a bedtime berry combination that stacks multiple kidney supportive benefits together. Bedtime fruit number 7, pineapple. The 7th fruit surprises people most often because it's acidic, tropical, and doesn't fit the typical image of a kidney protective food. Clinical nutritional guidance for kidney disease patients, referenced in NIH published materials, specifically includes pineapple as a recommended low potassium fruit for kidney patients, with 1 serving equaling half a cup of juice or 1 small portion of fresh fruit. The National Kidney Foundation's Potassium Guide for CKD patients classifies pineapple as a low potassium choice, making it one of the safer tropical fruit options for people who need to manage their potassium intake. What makes pineapple particularly interesting for kidney health is bromelain, a natural enzyme found in fresh pineapple that has documented anti-inflammatory properties. Bromelain has been studied for its potential to reduce inflammatory markers, and since kidney disease progression is driven heavily by chronic inflammation, any natural anti-inflammatory that fits within a kidney-friendly nutritional profile is worth knowing about. There's also a practical sleep connection. Fresh pineapple contains tryptophan, the same amino acid precursor to serotonin and melatonin that contributes to a more relaxed, sleepy state when consumed in the evening. It's not a sedative effect, but it contributes to a more natural winding down pattern when eaten as part of an evening routine. What to do? Half a cup of fresh pineapple, cut into chunks or spears as a light evening snack. Fresh pineapple retains significantly more bromelain than canned pineapple, which is typically heat processed in a way that destroys most of the enzyme content. Choose fresh whenever possible for the anti-inflammatory benefit. Bedtime fruit number 8, the one with a catch. This is the one I told you to stay for, and the catch is real. Cranberries have been associated with kidney and urinary tract health for decades, and there is genuine research behind that connection. But there are 2 very specific things most videos about cranberries and kidneys get wrong, and I want to give you an accurate picture of both. The NCCIH, National Center for Complementary and Integrative Health, part of the NIH, confirms that cranberry products may decrease the overall risk of recurrent urinary tract infections, UTIs, in women who have had previous UTIs, with the FDA allowing manufacturers to claim limited evidence for this benefit on product labels. The mechanism is thought to involve proanthocyanidins, PACs, in cranberries that prevent bacteria from sticking to the bladder wall. However, cranberry products do not treat existing UTIs. The NIDDK directly states that cranberry products do not treat existing bladder or kidney infections, and that while some research suggests they may help prevent UTIs, there isn't enough evidence to be certain. So the honest picture on cranberries is this. The UTI prevention benefit is real, but modest, and applies specifically to certain populations. It is not a treatment for an active infection, and the evidence is described as limited and inconsistent, even for prevention. Now, here's the catch specific to kidney health. Raw cranberries are extremely tart and are rarely eaten plain. Cranberry products marketed for health, juice cocktails, sweetened dried cranberries, and flavored cranberry supplements often contain very high amounts of added sugar. The National Kidney Foundation specifically warns that sugar-sweetened beverages are linked to an increased risk of kidney disease. A cranberry juice cocktail, marketed as being good for your kidneys, can simultaneously contain enough sugar to work against them. The benefit lives in the unsweetened whole cranberry form, not in the sweetened products that most people actually buy. What to do if you use cranberries for kidney health? Choose unsweetened 100% cranberry juice, unsweetened dried cranberries in small portions, or raw or frozen whole cranberries. Avoid cranberry juice cocktails and sweetened cranberry supplements. And if you think you have an active UTI or kidney infection, see a doctor. Cranberries do not treat infections. One more caution. The NCCIH notes there is conflicting evidence about whether cranberry interacts with the anticoagulant warfarin. If you take a blood thinner, mention cranberry use to your pharmacist before making it a daily habit. The bedtime kidney tonic. Now that you know all 8 fruits, let me give you a simple combination you can make tonight. Take a small bowl and combine half a cup of tart cherries, a handful of blueberries, and 3 to 4 fresh strawberries. That single bowl delivers phytomelatonin for sleep and nocturnal blood pressure support, anthocyanins for anti-inflammatory kidney protection, vitamin C for immune and tissue health, fiber for gut microbiome support and phosphorus moderation, and low enough potassium to be suitable at all stages of kidney disease. No supplements, no prescriptions, no complicated preparation. Just 3 kidney-verified fruits in a bowl, eaten 30 to 60 minutes before bed. If you want to add a liquid component, a small glass of unsweetened tart cherry juice alongside this combination is the closest thing to a genuinely research-backed kidney bedtime tonic available from whole food sources. When to call your doctor. Every fruit on this list is classified as kidney-friendly by the National Kidney Foundation in general terms, but general terms are not individual terms. If you are at an advanced stage of chronic kidney disease, stage 4 or 5, your potassium and phosphorus limits may be strict enough that even low potassium fruits need to be counted carefully within a specific daily budget. Your kidney dietitian is the right person to tell you exactly how much of any of these 8 fruits fits your individual dietary prescription. The National Kidney Foundation specifically notes that in the early stages of kidney disease, there is usually no need to limit potassium unless blood levels are high. But in later stages, or complete kidney failure, a doctor or kidney dietitian may recommend stricter limits. If you have not had a kidney function test recently and you are over 60, that is worth requesting at your next appointment. A basic metabolic panel includes creatinine, EGFR, and electrolytes, including potassium, the 4 numbers that together give a clear starting picture of where your kidneys stand. You cannot make informed dietary choices for your kidneys without knowing those numbers. Let me tell you about a patient I'll call Carol, 72 years old, managing stage 2 chronic kidney disease with a secondary concern of poor sleep and frequent UTIs. When we reviewed her diet together, she had cut out almost all fruit out of a reasonable but over-applied fear that fruit meant potassium, and potassium meant risk. What she'd actually done was eliminate the primary source of antioxidants, anti-inflammatory compounds, and sleep-supportive nutrients from her evening routine. We rebuilt her evening fruit intake together, guided by the National Kidney Foundation's kidney-friendly fruit list. Tart cherries before bed for sleep and overnight blood pressure support, blueberries and strawberries for antioxidant coverage, unsweetened whole cranberries 3 times a week for UTI prevention support. Within 6 weeks, her sleep had improved noticeably. Her UTIs, which had been occurring almost monthly, had not recurred in 2 months, and at her quarterly kidney function check, her markers had remained stable, the realistic near-term goal at stage 2. She told me at her next visit that the biggest surprise was how satisfying the bedtime fruit routine had become. It felt like something she was adding to her health rather than another thing to restrict. And that shift in mindset made it far easier to maintain than any purely restrictive dietary change she'd tried before. Everything in this video is educational information based on published research and National Kidney Foundation guidance, not personalized medical advice. No dietary change should replace your kidney dietitian's individualized recommendations. If you have advanced chronic kidney disease, are on dialysis, take blood thinners, or have been given specific dietary restrictions by your healthcare provider, Always confirm any new food addition with your care team before making it a regular habit. Your action plan. What to do tonight. 1. Tart cherries, half to 1 cup of sour or Montmorency variety or unsweetened tart cherry juice 30 to 60 minutes before bed. 2. Blueberries, half a cup, fresh or frozen, as a bedtime snack. 3. Strawberries, half a cup, containing 130 milligrams of potassium per serving, safe for all CKD stages. 4. Apple, 1 medium apple with the peel on for fiber, blood sugar stabilization, and antioxidants. 5. Grapes, a small handful of red or purple varieties, or freeze them if you're on fluid restriction. 6. Raspberries, half a cup, the highest fiber fruit on the list for gut microbiome and anti-inflammatory benefits. 7. Pineapple, half a cup of fresh pineapple only, not canned, for bromelain's anti-inflammatory benefits. 8. Cranberries, unsweetened only, for UTI prevention support. Check with your pharmacist if you're taking warfarin. Build a simple bedtime bowl, starting with fruits 1, 2, and 3 tonight. Introduce the others one at a time over the following week so you can notice how your body responds. What's next? If you're going to make the bedtime kidney bowl tonight, tell me in the comments which 3 fruits you're starting with. I read every single one. If this kind of real, well-sourced information is what you want more of, subscribe. New videos every week covering what the research actually says about kidney health and healthy aging after 60. I'm Dr. William, and my next video covers the 5 everyday drinks that are quietly raising your creatinine, including one that's marketed specifically as a health drink. I'll see you there.